The chair is pleased to recognize the ranking member of our full committee, Congresswoman Cathy McMorris Rodgers, for your 5 minutes opening statement.
Thank you, Madam Chair. And Mr. Secretary, welcome back to the Energy and Commerce Committee. This is an important day, and we have important questions that need to be answered. Health and Human Services has been at the forefront of the COVID-19 response. You have jurisdiction over CDC, NIH, and many other agencies. And unfortunately, we've seen too many examples where Health and Human Services seems to prioritize what is an extreme political agenda rather than staying focused on mission. The mission is to improve the health and well-being of all Americans. I'm very concerned about a lack of transparency that is eroding people's trust in public health and eroding confidence in Health and Human Services. First, there's the administration's confusing response when it comes to the public health emergency. The administration's decision-making hasn't been based on science. What we see more and more is that it's based upon power and politics. President Biden wants to lift Title 42 for a radical open border agenda, despite an overdose crisis that is killing more than 100,000 people a year, mainly because of illicit fentanyl coming across the southern border. According to President Biden, there's no COVID-19 emergency for illegal immigrants, but there is for toddlers in Head Start who are still forced to wear a mask. Student loans are still being deferred, costing taxpayers $4.3 billion per month and making the inflation crisis worse. We see the administration fighting to keep the mask on for those that are traveling on airplanes. None of this appears to be rooted in common sense, science, or an awareness of the crises in America today. People want their freedom back. This is the land of the free. They want a secure border, a healthier future for their children, safer communities, and they want leadership that reflects these priorities. We're not in the same place we were 2 years ago, and that is why in February, I asked for the administration's plan to properly unwind the public health emergency, and I've yet to receive a response. I also want to discuss the Centers for Medicare and Medicaid Services' unprecedented decision to restrict coverage for an FDA-approved Alzheimer's treatment to only 1,300 to 1,500 people fortunate enough to have been in the clinical trial. Worse yet, this decision applies not only to the recently approved drug Aduhelm, but an entire class of Alzheimer's treatments. We should trust doctors and patients to decide if an FDA-approved drug is right for them. FDA determined the drug is safe and effective, including for seniors in the Medicare program. This decision is clear second-guessing of FDA's authority to determine drug safety. Democrats may say that the drug would bankrupt Medicare, but it's hard to take that concern seriously when Democrats voted for using savings from their government drug price control proposal to subsidize and inflate health insurance premiums for people not on Medicare. I urge that this proposal not be resurrected and that you rethink the national coverage decision. There's also other examples of how the department is losing the public's trust. Inflation from out-of-control government spending is making everything more expensive, including health care and for seniors on fixed income. Seniors are now paying 15% more, the largest dollar increase in program's history. Yet bipartisan laws signed by President Trump to lower costs remain unimplemented and unenforced. We're still waiting for the rules to make it easier for people to know what doctors are in network, and we haven't seen enforcement against hospitals refusing to post their prices. Yet we've seen other top priorities, millions of dollars for a climate change office, forcing healthcare workers to perform abortions on demand, policing speech with big tech companies, price controls for fewer cures, colluding with teachers' union to keep the schools closed and kids masked, undermining the rights of parents, avoiding oversight for how taxpayer dollars are spent on risky research in China, and again, the open borders instead of cracking down on fentanyl trafficking. This is not inspiring confidence. My message to Health and Human Services today is to stop digging the hole. Let's build trust. Let's make sure that we are trusting people to make the best decisions for themselves and their families. Our mission is to improve people's well-being. And with that, Mr. Chairman, Madam Chairman, I yield back.